we are talking weak pelvic floors. So maybe you've been told before by your obstetrician, your gynecologist, your midwife, or whoever your healthcare provider is that you use, that you have a weak pelvic floor and you need to strengthen it. Okay, but what exactly does that mean? Because there are actually two types of pelvic floor weaknesses, and if you fall into one of those categories, then you may not necessarily need to be strengthening your pelvic floor first and foremost. You actually need to learn how to relax it first. And then if you fall into the other category of having a weak pelvic floor, then yes, maybe you do need to start strengthening that pelvic floor and those deep inner core muscles with your breath so that it can be firing more. So we're going to talk about that in this video. So before we move on, I do want you to know that this video is not meant to replace pelvic floor physical therapy. To really get a true idea of what is going on with your body and your core and your pelvic floor, I always suggest that all of my clients make an appointment with a pelvic floor physical therapist to have themselves fully evaluated. Okay, so what exactly categorizes a weak pelvic floor? Well, there are two types of weak pelvic floors. There is one where your pelvic floor is too tight. It holds itself too tight. It clenches too much, and it's in constant tension, so it's not always able to fully relax and contract. So therefore, you're not able to get a good pelvic floor contraction, which can lead to pelvic organ prolapse, leaking, pelvic pain, which can manifest or show up by way of pain when inserting a tampon, pain when you go to see your healthcare provider for a pelvic exam, or pain during sex. So that's the first type of weak pelvic floor. The second is you really cannot get a good contraction with your pelvic floor muscles. They feel like they've kind of jumped ship, or they've taken a vacation, and sometimes that can happen. Sometimes our muscles can decide to just take a break, and we need to get them going again. So I'm going to show you how to assess yourself. Again, this is not meant to replace pelvic floor physical therapy, but it's a good tool to help you become more in tune with your own body and to really know what's going on with your core and your pelvic floor. So we're going to talk about how to identify what your pelvic floor is doing. So I'm going to have you lie on your side, and we're going to be doing this assessment by using our fingers. No, we are not going to be going inside, so I'm not going to show you how to do that in this video. You can obviously do that in the comfort of your own home, and you can do an internal test on yourself using your fingers. Just make sure that you use a lot of lubrication, especially if you know that you have pain with inserting anything into your vagina. So you can do that internal exam on yourself at home, but right now I'm going to show you how to do it outside of your clothes and assessing the space between your vagina and your anus, called the perineum. Now, if you don't know what the perineum is, you can just go ahead and Google it and find out more information about it, but for the sake of this video, it's that fleshy space between your anus and your vagina. So I'm going to have you lie on your side, bring your knees out in front. You're going to take your fingers, find your sits bones. So it's that bony point on your butt, that's your sit bones. And you're going to take your finger and slide down, so that's where your anus is, and then go up just slightly above that, and that soft, squishy area is your perineum, okay? So when you go to touch that area, that perineum, that tissue should feel soft and squishy to the touch, all right? Now, when you go and place your fingers there and it feels really tight, then that can be a sign that your pelvic floor is too tight. All right, now, first things first, I want you to identify is if that tissue feels soft and squishy. If it feels too tight, that may be a sign that your pelvic floor is too tight. If you feel like you just can't, you're not feeling anything, then that could be a sign that your pelvic floor needs a little bit of strengthening, or you just need to take some more time and practice this, all right? So now you're going to do a Kegel. So I want you to take a nice big inhale, exhale, draw that vagina up like you're trying to pull a tampon even up higher into your vagina, or you're trying to pull your pelvic floor muscles up towards your belly button, okay? So when you do that, you should feel that space, that perineum, contract and get tighter, because that tissue is attached to your pelvic floor muscles. So when those pelvic floor muscles contract, that tissue draws up and it starts to feel tight underneath your fingertips, okay? And now you're going to inhale and relax, and you should feel that space become soft and squishy again, okay? So let's try that again. So, nice big inhale, exhale, draw everything up, okay? Inhale to relax. You should feel that tissue relax, okay? So now, if that pelvic, or if the perineum feels very tight underneath your fingertips when you are touching the perineum, then that can be a sign that your pelvic floor muscles are too tight, and you need to focus on both, or you need to focus on really relaxing those muscles. So just think about it this way. If you go to flex your bicep, you can't hold your arm like this all day long in order to use your arm. You have to both contract and relax your arm in order for your arm to move well. Same thing happens with your pelvic floor. You have to learn to let those muscles relax. And a big reason why that pelvic floor gets really tight is because, and a lot of us moms do that, or do this, is you are clenching through your glutes all the time. So if you're always holding your glutes all the time, that has a tendency to tell your pelvic floor to just stop working. So make sure you check to see what your glutes are doing throughout the day. Now on the flip side, if you don't really feel anything going on with that tissue at your perineum, then this could be a sign that you need to work on strengthening your pelvic floor with Kegels, but with Kegels that are done with your breath work, not just doing a Kegel over and over and over again, okay? So we have to learn to train our entire core as a system, because if your pelvic floor muscles are weak, meaning they just sort of jump ship and they're not working for the time being, we have to train your inner core muscles to work in unison with your pelvic floor muscles, because if your transverse abs, your deepest abdominal muscle, is not functioning properly, then that also sometimes tells your pelvic floor to stop working as well. So we have to get your pelvic floor muscles, your transverse abs, your diaphragm, and the little muscles in your back, the multifidi, to all be working together in order to help get those pelvic floor muscles firing well again. So, again, if your pelvic floor is weak, then you need to possibly train your deeper core muscles. Something else that might be going on is you may need to start releasing some of the muscles in and around your hip, because if they're not firing as they need to, or they're overworking, then that can also cause your pelvic floor muscles to jump ship. So there you have it. That is a simple self-assessment tool that you can use at home to help you learn better about your body and to help you discover more about what your pelvic floor is doing.